This is Christine Porter with the Times News. I'm talking with Dr. Lakshmi Kannan about diabetes. She's an endocrinologist with Coordinated Health, a part of Lehigh Valley Health Network. Is there a genetic component to diabetes?
There is a strong genetic component, and there are many ways how genetics can affect one's risk of type 2 diabetes. It is a multifactorial disease with a strong genetic predisposition.
How often should blood sugar be tested?
There are many factors before we make a recommendation for a patient, so there is no one-size-fits-all for that answer. It depends on what medications, what your goals are, what other medical conditions you have, your lifestyle and such. So it could vary from once a day to multiple times in a day. There are some people that we advise only they check periodically, which could be a few times a week. Diabetes can affect many parts of your eye. Retinal disease is just one part of it. And it's important to go to the eye doctor, not just to discover undiagnosed retinal disease, but also to make sure that other parts of the eye are examined. Diabetes is associated with dry eyes, premature cataract formation, and many other diseases within the chambers of the eye. So it is important to go to the eye doctor even when you don't have symptoms.
Oh, wow. Okay. A fatty liver can be an indication of insulin resistance. Is that correct?
Absolutely. It is correct. So insulin resistance within the liver, that is the issue with fatty liver. So there are glycogen stores, glucose stores within the liver, and fat deposition in the liver absolutely can increase insulin resistance in the body.
Okay. Now, if a person has been told, hey, you have a fatty liver, syndrome, should they get regular testing of their blood sugar levels?
It is recommended. Most people with fatty liver also struggle with weight issues. So if you have certain risk factors for diabetes, again, the American Diabetes Association has defined these specific risk factors. So your doctor will be looking for these risk factors in order to test you for diabetes even without symptoms. And that is called screening for diabetes.
Okay. Are there any new medications out there for diabetes?
There are many that are being studied, but in the last 7 years, we've made a lot of progress in terms of treatment options. So we've had much more come out in the past 7 years than in the past 40 years, so to say.
Wow.
So there are many exciting developments under progress too.
Do people with diabetes, if they are feeling good that day, do they need to always take their medication?
Absolutely, that's an excellent question. Before you develop symptoms, a lot is happening within your body, and it may be too late to wait for symptoms. So it is important for us to check even though the patient's feeling well.
See, how about the importance of exercise? Can it make a difference with diabetes?
Exercise plays an inherent role in treatment for many reasons. Exercise will help lower insulin resistance, which is the underlying key element in type 2 diabetes. When you exercise, though, your body is able to bring your blood sugar down independent of insulin action. So it can, to a certain extent, bypass insulin resistance, and it also has a metabolic benefit. So exercise is very important in the treatment of diabetes.
How often should a person exercise and for how long?
For general health and body weight maintenance, the recommendation is at least 30 minutes of moderate intensity aerobic activity. 5K is defined as any exercise where you're able to talk while you're exercising.
I heard the 30 minutes, 5 days a week, and at a level of aerobic that you can talk.
Yes, it's called moderate intensity activity.
What's your greatest concern for people with diabetes?
It's their health, because diabetes is a part and parcel of how you feel now, how you're going to feel in the future, and what's going to happen, through every walk of life, so to speak. So it's something you live with. It is, again, generally speaking, it will have an impact on all aspects of health.
Thank you to everyone for joining us at home. And for more health tips during the COVID-19 pandemic, please visit the Lehigh Valley Health Network news blog at news.lvhn.org.